There isn't one method of birth control that suits everyone because individuals differ and how the system functions differ. So before you choose a birth control method, you need to answer some of these questions that we're going to be looking at in this video. Welcome back to my channel, everyone. If this is your first time on this channel, please click on the subscribe button, turn on notifications so you'll be able to get updates when there's a new video. And for my returning subscribers, thank you so much for coming around. Now, here are some of the questions we need to ask ourselves before choosing a birth control method. Number one question says, do you want to have children someday? And then how soon? Now, intend to have children in the next 1 year. The birth control method you are going to go on will not be the same with someone who intends to have children in the next 5 years. Now, there are pills, there are injectables, there are implants, and IUCD. With the knowledge of when you intend to have babies, the right birth control will be chosen for you. There is this implant that lasts for about 5 years. So if you intend to have baby in the next 1 year, you will not be placed on an implant that will be lasting for 5 years. So this question is very important before you decide which birth control method you want to choose. Number two question is, do you have any health condition? Now, if you have a health condition, the method of birth control you will be placed on will not be the same with someone who do not have any health condition at all. If you're diabetic, if you're hypertensive, if you have thyroid problem or something that might impact the choice of birth control, ensure to open up to your healthcare provider in that regard. Number three question is, how often do you have sex? This is very important in determining which birth control method you will go on. All right, if you are someone who actually have regular unprotected sex, then the method of birth control you will be placed on will be different from someone who do not have such. Okay, so ensure you discuss all of this with your healthcare provider. Number four is, how many sex partners do you have? Now, if you're someone who has multiple sex partner, the method of birth control you're going to be placed on will be different from someone who do not have multiple sex partner. With multiple sex partner, you will have chances of contracting sexually transmitted infections and sexually transmitted diseases. So you will have to open up to your healthcare provider so you know the method of birth control to be placed on, and you'll be advised on the right method of birth control to go on, whether you can just go on the pills, whether you can just go on the implant, or go on using the barrier method, which is the condom. So opening up on this will help you and help your healthcare provider in choosing the right birth control method for you. Number five question is, do you also need protection from HIV/AIDS and STDs? Now, if you are also trying to protect yourself against HIV/AIDS and STDs, then the method of birth control you're going to be given will be different from someone who is not afraid of this or who is not trying to protect herself from this. Okay, so you ensure to open up to your healthcare provider. If you are afraid of HIV and STDs along with pregnancy, then you won't be going on implants, you won't be going on, say, the injectables just to prevent pregnancy. You'll be going on something more, and that is what you are going to be discussing with your healthcare provider, and that will guide them in choosing the right birth control method for you. Number six question is, how well does the birth control method works? Now, you need to actually ask how effective the birth control method is, okay? Because there are women who go on birth control and still end up becoming pregnant. All right, so you need to actually discuss with your healthcare provider, what is the percentage effectiveness of this birth control? Is it 50%? Is it 60%? Is it 70%? That way you'll be able to know whether you should be combining barrier method with your birth control method during your fertile windows to prevent the possibility of an unplanned pregnancy. So you need to know this, and that is by asking how effective this birth control method is. If it is 100% effective, then you know that, oh, everything is fine. But if it is 50% effective, you know that you need to do some extra things to make sure that you do not become victim of an unplanned pregnancy. So this question is also very important when choosing birth control method. Number 7 question that you need to really ask is if there are side effects. Now, this is very important. Now, birth controls come with different side effects. Some are more severe than the others. So by asking these questions, your mind will be prepared as to what the side effects of these birth control methods are, all right? And once you know their side effects, you'll be able to choose which one you feel you will be able to tolerate, and then you go for that one. Now, birth control comes with lots and lots of side effects. There are people who come down with very heavy period, like some comes down with periods that last beyond 14 days and very heavy, all right? Some fever, headaches, some extreme weight gain, some extreme weight loss, and the rest of them. So ensure to ask about the side effects of the birth control method you are going to be going on, so that you will make your choice before you go on them, all right? And if it is side effects that you know that you will not be able to deal with, then the method will be changed for you. So it is very important to ask the side effects of birth control method before you go on them, because some of these birth control methods can have lasting side effects, all right? There are some who come down with hormonal imbalance after they have stopped the birth control, and by the time they are trying to conceive, it becomes difficult. I have a lot of patients with such conditions. They have stopped birth control method, but their period is no longer regular. I feel like that is a side effect of the birth control method they have been on. So if you want to go on birth control, be very, very careful when asking about the side effect. Ensure that you are deliberate about it and make sure to know exactly what your side effects are, and even future side effects before you go on them. Number 8, which is the last question, says, will you be able to use it correctly every time? Now, this is very important. Now, there are different methods of birth control. Like I said, there are some that are pills and you need to be taking every day. There are injectables that you need to be taking every 3 months, okay? So before you choose, you need to ask yourself, will I be able to take this thing correctly? If you're going to be going on the pills, you ask yourself, will I be able to be taking these pills every single day? Will I remember to take them every day? Okay, will I remember to go for my injection every 3 months? Will it be convenient for me? Will taking these pills every day be convenient for me? So you need to actually consider this before you choose that method of birth control. Because if you choose a method that has to do with you taking every day, or maybe something that has to do with date, you need to calculate this day I take, this day, then you need to be very sure that you will be able to take it correctly. Because once you miss out, then the chances of you actually coming down with an unplanned pregnancy kind of increases, okay? So ensure that you are sure you will be able to take or follow this method correctly before you go on them, all right? And if you know that you will not be able to follow it correctly, then you can discuss with your healthcare provider for the method that will be suitable for you. So ensure you do all of this when trying to get a birth control method. So these are some of the questions you should ask yourself. How long do you want to wait? And how soon do you intend to take in? So all of this will guide your healthcare provider as to which birth control method to place you on. Don't just go on any birth control method, or you just walk into any family planning center and say, I need a birth control pill, and then you're just placed on any one and that is it. Don't do that. Ensure you ask all of this question. Your health condition needs to be put into consideration. You know, your future plan as regards pregnancy needs to be put into consideration. STDs, STIs needs to be put into consideration when you are choosing a birth control method. So don't ever neglect this. And there are people who walk into pharmacies and don't know to get some pills to just swallow. Ensure that you do not do that. Ensure you go to a proper environment where the right thing will be done for you to prevent future side effects of the birth control method you might decide to choose for yourself.